This is the hour of doom
and bloom.
That's right, friends and neighbors. Welcome to the Doom and Bloom Survival Medicine Podcast, a scintilla of satisfaction in a scurrilous world. I'm Joe Alton, MD, that old Dr. Bones, co-founder of the survival medicine website doomandbloom.net, where you'll find, over 1,200 articles, podcasts, and videos on medical preparedness.
And I'm Nurse Amy.
That's right.
Actually, I'm Amy Alton, and I am an advanced registered nurse practitioner and a certified nurse midwife.
And purveyor of quality medical kits, some one of a kind, at store.doomandbloom.net. Not to mention the hostess with the mostest, so awesome that even ducks have a high opinion of her, even if she doesn't have any bread. Now listen, on this show you're going to get the conventional wisdom and the unconventional medical wisdom as well. That's what it takes maybe sometimes for your family to get medically prepared for tough times. But before we start, you got to listen to this.
Absolutely. All information and opinions voiced on the Survival Medicine Podcast are for entertainment purposes only and do not represent medical advice for anything other than post-apocalyptic settings. We strongly urge our audience to seek modern and standard medical care whenever and wherever it is available. Please.
That's right. Ignore us. Nothing to see here. But what happens if things go south? And I don't mean Cuba. Are you ready if the you-know-what hits the fan? Listen to us and you'll take another step on the road to preparedness. You know, I mentioned in a recent show that the family medic won't have lab tests and fancy diagnostic imaging like MRIs and CT scans to help with medical issues if some disaster throws us off the grid. You, medic, will have to go by physical signs and symptoms just like they did in the 19th century, which is just about where you'll be thrown back to medically. In a recent show, I used thyroid problems as an example. These days, you're going to get a lot of studies and blood tests, sonograms, stuff like that to look for nodules and other kinds of thyroid problems. Now, you're not going to have that, but you will have to work somehow. So work empirically. Now, what do I mean by empirical? Like the evil empire in Star Wars? No. Empirical therapy is medical treatment based on experience, signs and symptoms, and other information that essentially gives you the basis for an educated guess in the absence of complete or perfect information. Perfect information would be knowing exactly which species of bacteria or virus caused a specific infection and what antibiotics, let's say, if it's a bacteria, would be sensitive to it. In other words, having unlimited technology at your disposal.
Yep.
Now that leads you to a definitive answer as to exactly what's going on. That's great. It leads to definitive treatment. That's a luxury, though, you have when modern medicine is around. And even then, sometimes you might be wrong. Going empirically without a definitive diagnosis is a terrible way to have to treat medical illness, but it's going to be all you have if some disaster knocks you off the grid. It's all your ancestors had back then, and you know what? The human race still exists, so your people might survive actually having you as a medic after all.
It's not such a miracle. It can happen.
That's right. So let's talk about thyroid problems. You might think that a medic knowing about thyroid issues isn't really survival-ish type medicine, but it's actually more survival medicine than stopping hemorrhage, splinting a sprain, or other stuff that bushcrafters really want to know about. That's first aid, or even maybe wilderness first aid, I'll admit that. But these topics assume you've got a way to pass the victim off to a higher medical resource.
Someone's coming in.
That's right.
To rescue you take you away.
They might not be right at hand, they might be miles away, but there's a possibility they can one day get to modern medical care. Now, if you're really concerned about some long-term event that could take society to the brink, well, the medic's going to have to learn about chronic illness. We'll have to learn about infections, nursing care as well, very, very important.
Yeah, we're going to talk about that next week.
That's right, as well as pre-hospital trauma care, which is a basic first aid.
Right.
There is no pre-hospital anything, however, in survival because there won't be a hospital. So think about what would have happened, let's say, if COVID-19 had a 5 or 10% death rate. Do you think there would have been a functioning medical infrastructure? I doubt it. So therefore, things like high blood pressure, heart disease, diabetes, people are going to be coming to you with problems like this in survival settings, and you better have a plan of action. And don't forget tooth decay and other dental problems. So that's another entire show or two that we're going to be doing.
Oh, it'll be fun to show the extractors.
That's right, yep. So I hope you have a better idea of what it's going to take to be an effective medic in survival settings. It's a hard reality, but it's a reality. Okay, back to the thyroid. The thyroid gland is a small butterfly-shaped organ that's located in front of the neck below the Adam's apple. If everybody has an Adam's apple, it's just more prominent in men. Or let's say, I'm not sure if you can say that women have Adam's apples. They don't have Adam's apples, but they do have a cricoid cartilage, which is indeed what the Adam's apple is. It's much more prominent in men, but if you feel the neck, you would be able to tell. It's found that the thyroid itself is found at the level of the windpipe, also known as the trachea. Now, when you apply a thumb and forefinger lightly to the area, or use 2 hands from behind the patient.
Okay.
Let's actually do a little show and tell.
Okay.
This is how you examine a thyroid.
Patient.
I'm the patient. But she's doing the right thing, actually. She's using.
Well, I was choking you. That wasn't the right thing.
She's using the fingers of 2 hands to
Yes.
go between my suprasternal notch, this top of the breastbone here,
Right.
and below my Adam's apple or my cricoid cartilage, right in the middle. And she's feeling. Now
But not too hard. Don't push too hard.
No.
This is a gentle sort of, you're up against the skin. You're not really pressing in too much. You are in a little bit, but you're not trying to squeeze in there. You want to be very gentle with your touch.
Now, feeling when you're doing an exam is known as palpation. So if you're palpating this area and you ask the patient to swallow.
Could you please swallow, sir?
Yeah, I'm swallowing. You'll notice that the thyroid will move.
Up and down, right.
That's right, it moves up and down. Or you could actually take a sip of water and it will move up and down.
Of course, you talking is difficult because
Yeah.
everything's vibrating. I felt it.
There you go.
Yep.
And so that's one way that you can evaluate for things like nodules and stuff. Indeed, I do have a nodule. It just happens to be very small. But it is not affecting the thyroid function. Let's talk about the thyroid function. Now, why is the thyroid gland so important? It's tiny. The thyroid gland produces hormones that act as chemical messengers to regulate your metabolism and control lots of vital functions in your body. The thyroid gland maintains a hormonal balance between itself and 2 other organs, the pituitary gland and the hypothalamus. These are both found near the base of the brain, and simple physical exam really just can't reach them. When this balance is disturbed, however, we experience a dysfunction in the thyroid and its production of thyroid hormone.
Right.
Usually this involves the production of either too little or too much hormone. These malfunctions can occur in anyone, but they're more commonly seen in women. Now, let me tell you a little bit about a real third world thyroid disease that you might see in survival settings, and that is goiter, an issue that might be common in survival settings. A goiter is a lump that represents, well, a sometimes really striking in appearance enlargement of the thyroid gland. This little tiny thing is about the size of a butterfly, and indeed, it is really big in people, or it can get really big in people that have goiters. It's a result of a deficiency of iodine in the body, and one of the reasons why common table salt is now iodized.
Right.
So before iodide was actually added to salt, goiter was much more common in developed countries than it is today. According to the National Institute of Health, goiter had become so common in the 1920s, just 100 years ago, that places like the Great Lakes, the Appalachians, and the northwestern regions of our country were actually nicknamed the Goiter Belt. So pretty amazing that that just happened 100 years ago. There were people, Americans with a bunch of goiters roaming around parts of the country. Now, potassium iodide tablets like you have for nuclear reactor meltdowns or atomic bombs, ThyroSafe is the brand that we have on our store, may be a treatment option for goiter if no other source of iodine is available. In nature, though, and which is always better to find your
Supplements, vitamins, nutrition. From food.
From
Much
food.
Better.
You can find it in kelp, oysters, shrimp, cod, haddock, all sorts of fish, and interestingly enough, dairy products. These are a much better idea to get your nutrients from.
Yep.
So the things that you want to know is what's going on with iodine allergies and seafood allergies. Now, unfortunately, use of iodines, while a known treatment, can actually worsen certain conditions and even thyroid conditions in some cases. Now, this is rare, luckily, and it's used, and it happens when thyroid potassium iodide is used in large amounts or for a long period of time.
Right.
So you might have had a CAT scan or some kind of test,
Radiological study.
right, that involved the use of iodine contrast dye. And interestingly enough, you may have been asked by, let's say, a interventional cardiologist if you're having a cardiac catheterization,
Right.
or some other CAT scan that had
Sure.
involved contrast, the radiologist might ask you if you were allergic to seafood or
Right.
allergic to shellfish.
Right.
Now, the funny thing about that is that that's something that doctors do for almost essentially no reason. There's a 3% chance that you are allergic to iodine, and there's a 3% chance that you're allergic to iodine contrast dye, whether or not you claim to be allergic to shellfish or not. Now, the funny thing about shellfish is that it's not the iodine that actually causes the allergy. It's actually two proteins known as parvalbumin and tropomyosin. That is actually what causes the seafood allergy in most cases. These proteins, not the actual iodine. As a matter of fact, it is now not, iodine is not now considered a specific allergen, although iodine contrast dye is a different creature altogether, and you can indeed have, like I said, a 3% chance that you're allergic to iodine contrast dye. So it is sort of interesting, but despite that, and despite knowing this information, still 65% of radiologists and 89% of cardiologists will ask about seafood or shellfish allergies prior to administering iodine contrast dye for CAT scans and things like that. And 35% and 50% respectively between radiologists and cardiologists stated that they would withhold contrast media and recommend steroids or just stopping the procedure altogether for people that claim seafood or shellfish allergy. And that was in the Journal of Hospital Medicine, in an interesting series they have that I'll probably bring up again in the future on other topics,
This is great. I love the title of this.
called Things We Do for No Reason.
And
We being doctors.
Yes, and the reason you guys do them is because when you were in school, your professors told you, you always do this, and they beat it into your heads, and so it's stuck there. And despite learning now that 3% of all population, seafood allergy or not, has an allergic reaction to the contrast dye, they still ask the question, and they still withhold it, and they still make them go have something special done because of it. It's
And
just,
even though the shellfish allergy is actually due to proteins in the fish, not due to the
not the
iodine.
iodine. Exactly.
So interesting, and I'm sure you'll find
Crazy.
a doctor somewhere that's going to disagree with me, but it's right there. And it's been
Statistics are statistics.
Published in respected journals.
There you go.
All right, well, anyhow.
So what about lumps?
Lumps on the thyroid. They can also develop, besides being a goiter, they can also develop for reasons that aren't associated with an iodine deficiency. They could exist without causing any symptoms whatsoever. I have no symptoms of thyroid problems, but I have a nodule in my thyroid. Or they could disturb thyroid hormone levels. It could present a lump that is, could present as a cyst, which is a mass filled with fluid, or a nodule. When I mention nodule, I mean a solid mass. I have a solid mass in my thyroid that luckily isn't doing anything. Sometimes they call that a cold nodule. Sometimes cold nodules could be cancerous though, so they have to be watched. And I have to make sure that mine doesn't grow beyond a certain size. You can barely feel it in my case, right?
Right.
All right.
Although yours is bigger than mine.
Aha, well, there you go.
Not by much, but it is.
But that's because I have a nodule there. In rare cases, it could represent a cancer, and it does have to be followed. Now, fortunately, thyroid cancer is relatively uncommon. It actually grows very slowly, even in the elderly, unless there's been exposure to radiation. Some thyroid tumors, however, are hot, and they produce a lot of thyroid hormone. That causes a condition known as hyperthyroid, the excessive production of thyroid hormone known as hyperthyroidism, and it usually comes on between the ages of about 20 and 50, but the diagnosis is usually made a lot later when people start really experiencing a lot of symptoms. Now, I said before That figuring out that the thyroid is malfunctioning is going to depend normally in normal times on certain blood tests, sometimes a scan of the gland, but that's not an option in a collapse. So it's important to learn what a person with elevated thyroid levels looks like. So some common signs and symptoms of this condition in adults are insomnia, hand tremors, nervousness, feeling excessively hot in normal or even cold temperatures. Notice that this is all sort of high metabolism or excessively high metabolism kind of stuff. There's a condition called Graves' disease in which the eyes appear to be bulging out or sort of staring. These people have frequent bowel movements, speedy, their intestines are working fast. Everything's right.
Moving along.
And despite that, they're losing weight despite a normal or even an increased appetite. They oftentimes have an increased appetite. They sweat a lot. They, like I said, lose weight. They may have periods that are off, they're scamped or they cease altogether.
Well, once you mess up hormones, usually, and thyroid is a hormone, it sort of cascades and it starts affecting everything else. So there's never just one thing that goes wrong with you. It usually affects a whole bunch of other things in your body.
Right. Hence all these symptoms, different symptoms that people are getting.
Yeah.
And if you're really old and you have this condition, you might have muscle weakness, chest pain, shortness of breath, things like that. If you're really young, you might have some problems developing puberty. You might have some growth issues, things like that. Now, poorly controlled hyperthyroidism can lead to a condition known as thyroid storm, in which very high levels of hormone cause major effects on the heart and the brain. All the above symptoms can combine with an elevated heart rate, fever, blood pressure, all sorts of irregularities to actually endanger the patient's life. To treat hyperthyroidism, it involves medications that block hormone production. If you're aware of a member of your group that happens to have hyperthyroidism, these drugs, which their doctor probably has them available for the patient, they should consider stockpiling them if at all possible, as they're going to be hard to find if modern medical care is no longer available. Substances such as I-131, also known as radioiodine, have been used to actually destroy an overactive thyroid. As you can imagine, this results in the patient producing no thyroid hormone at all and winding up needing an outside source for it. I-131 treatment, by the way, is useful in severe hyperthyroidism, but also is something else that's unlikely to be available off the grid unless you happen to be under a cloud of fallout from a nuclear explosion. Then you'll get as much radioiodine as you can handle.
Hopefully that will never, ever, ever happen.
That's right.
However, dietary restriction of nicotine, caffeine, alcohol, and other substances that alter metabolism will also help control high thyroid levels.
That's right.
Vitamin C and vitamin B12 are thought to have a beneficial effect on those with this condition, as does L-carnitine, which is not an easy word to say.
We have that.
L-carnitine, we do. We actually take that. L-carnitine may even lower thyroid levels without damaging the gland, which is always a good thing. If you can have a supplement to take without having to hurt yourself or remove a part of your body. Foods that are thought to depress the production of thyroid hormone also include cabbage, cauliflower, broccoli, we grow some of these, Brussels sprouts, and spinach. Yum, love spinach. In addition, foods high in antioxidants are thought to reduce free radicals that might be involved in hyperthyroidism. And these include delicious foods again, blueberries, cherries, tomatoes, squash, and bell peppers, among others.
Lots of great antioxidants there.
Yum.
Let's talk about hypothyroidism. More commonly seen than hyperthyroidism. This is much, much, much more commonly seen than that. Hypothyroidism is the failure to produce enough thyroid hormone. Now, a common cause of it is the misfiring of the immune system. Now, when this happens, the body actually targets the thyroid in an autoimmune reaction. The most commonly seen signs and symptoms of hypothyroidism in adults are, as you can imagine, the opposite of hyperthyroidism. And they involve things like a sort of a slowing down of metabolism. You're fatigued a lot. Instead of nervous, your intolerance to cold increases instead of being intolerant to hot. You have constipation instead of diarrhea. You have a poor appetite instead of an increased appetite. You gain weight instead of lose weight, like people do when they have hyperthyroidism. People with hypothyroidism also have some effects that on the skin, things like dry skin, hair loss. Their voice changes, they become hoarse, and these people wind up having depression because they're physically changing for the worse, and they can actually see it. If you take a look at a picture of somebody one year and then the next year, they sometimes are pretty strikingly different in the way they look. Let's see, menstrual irregularities and growth issues can also occur, just like they can with hyperthyroidism. And if you ignore this and don't treat with thyroid hormone, they wind up getting a lot worse with regards to their vocal changes, their hair loss, their skin, and they start swelling up a lot as well. Now, it should be noted that untreated hypothyroidism in a pregnant woman actually causes birth defects in the baby. There's actually an entire syndrome that a baby has that identifies it, the mother, have had hypothyroidism during the pregnancy.
Right.
Now, the treatment of this condition is based on the oral replacement of the missing hormone, which is called thyroxine. These drugs come in a variety of dosages. Really tiny increments, and it's important to determine exactly the right dosage. For that, a physician should evaluate and test your group member now in normal times while modern medical care is still available to figure out what is the perfect level. The lowest dose that will maintain normal thyroid levels is what they need. Too much may cause hyperthyroidism. Now, once you have determined the right dosage, you may consider in normal times asking a physician for additional supplies or even a prescription for a higher dose. This might allow you to use, say, half of the pill in the present and stockpile the other half for the uncertain future. Now, only do this if you know them very well and you intend to follow your physician's advice as to what the proper dose actually is. There's no benefit but significant risk to taking more thyroid replacement than you should. By the way, good luck finding a sympathetic physician. Most will consider this request absolutely unethical in normal times. I don't know if you can really argue with that. Besides standard thyroid medications such as Synthroid and Levothyroid, there are a number of other remedies that may have a beneficial effect on hypothyroidism. A number of thyroid extracts are available, which consist of desiccated and powdered pig or cow thyroid gland. The amount of thyroid hormone in these extracts may be variable. Therefore, the medical establishment recommends against their use. In the absence of modern medications, however, it's probably better than nothing. Now, one strategy that might help you decide what natural supplement may be right for you is to ask your physician to monitor your thyroid levels for 2 to 4 weeks or so while you try it out. If your thyroid levels drop like a stone on the supplement, well, it probably has little or no effect and you should research other options. If your thyroid levels remain normal on the alternative, well, you might continue monitoring long-term to see whether the product might be worthwhile to stockpile.
From a dietary standpoint, again, we're going to go back to dietary. This is the foods you should avoid. The good things that were for the hyperthyroidism are not good for the hypothyroidism.
Exactly, right.
All right, so avoid these: cauliflower, broccoli, Brussels sprouts, spinach, and cabbage. Sound familiar?
Yep.
A number of natural supplements such as Thyramine or Thyrovance are commercially available. And these are, again, unregulated as to what their exact effects are going to be on hypothyroidism. They're combinations of various herbs that are touted as beneficial for both low and high thyroid conditions. Your experience may vary. That's a disclaimer.
Yes, your experience may vary.
Some believe that selenium and vitamin B supplements may help, so it can't hurt. Why not?
I agree. Use all the tools in the woodshed.
Absolutely.
That's all the time we have for today. Thanks for watching and listening to
the Survival Medicine Podcast
with Joe Alton
/ Videocast.
That's right, with Joe Alton and Amy Alton. Thanks so much.
Bye-bye.
Hey, please consider supporting our mission to put a medically prepared person in every family by getting some of the quality medical kits, individual supplies, and personal protection gear available at store.doomandbloom.net.